Hello and welcome to this presentation. Thank you for joining and getting your tickets on Eventbrite. So it's 2 minutes past 10. So if anybody joins us later on, we'll get started in just 1 minute. So I'm Sarah Barker. I'm a registered nurse prescriber. I've been doing aesthetic treatments and skincare for about 18 years, longer than that if you include my own personal journey with skincare. I did suffer with acne after my first pregnancy, and that's what led me to get into aesthetics. So I qualified as a nurse, and I was actually having some treatment at a laser clinic for my own skin, and they actually wanted a registered nurse to train to do laser treatment for hair removal and for acne treatment and for chemical peels, and then that led on to Botox and dermal filler training. And when I first trained, there was only one type of Botox, which was the one that everybody's heard of, because Botox is actually a brand. And there was only a couple of dermal fillers on the market. There were Restylane and Juvederm. Hello, welcome. So if you're just joining, thank you. I just did a brief introduction. So I'm Sarah Barker, registered nurse, and I've been doing aesthetics for 18 years. And so I'm just going to give a little bit of a background into how the face ages, how the skin ages, and how we can hold it back as long as possible. So I'm just going to share my screen with you. Share, there we go. So just bear with me. I'm just going to get my presentation up now. Here we go. There we go. Right, so thank you for joining. So who am I? So I am Sarah Barker, registered nurse prescriber, as I've said. And just bear with me. Let me see how to put this onto full screen. There we go. Present. So I've been doing this for 18 years, helping people with their anti-aging journeys and dealing with my own skin issues. Sorry about this. So who am I? So I've got 18 years this year experience in facial aesthetics. So I started quite early on in the market, and as I was saying before, there were just one type of Botox, which is the brand Botox. That was the only toxin that was available. Then a few years later, Azulor came out and Dysport, so there was only 3, and now there's about 10 different anti-wrinkle treatments on the market, and a lot more fillers. There were only 2 or 3 fillers on the market when I first started, so it's been a heck of a journey, and it's got much bigger than when I first started. So I teach other medics how to do aesthetic treatments, particularly injectables, so anti-wrinkle treatments and dermal fillers. I've carried out my own research and launched various products. So the Flawless Pen was something that came from years of microneedling with rollers and the first electrical devices where I was getting tangled up in a web of wires and plugs, power wires and things. So I decided to launch the UK's first cordless microneedling device, which is called the Flawless Pen, that's still going strong now. And I'm a bit of a geek on all things anti-aging and skin. So hopefully you'll bear with me on this in-depth presentation. So at my clinic, it's located in Long Bennington, which is in between. Well, it's classed as Lincolnshire, but it's just on the Nottinghamshire border. So I'm from Nottingham originally, and I've also lived in West Yorkshire. So the main area that I cover is Lincolnshire, Leicestershire, Nottinghamshire, and some clients even come from Derbyshire. So it's quite a wide area that I get visitors from. So it's a registered medical clinic. I've done over I got an award for over 10,000 treatments, but it's probably more like over 15,000 now, because that was in 2023. So as I say, I'm quite experienced, and I do help and assist other clinics and medical practitioners with their training and mentor them with anti-aging treatments. So in my own clinic, my main treatments that I do are anti-wrinkle treatments. So as I've said, Botox is the most popular brand that people have heard of, but I use Bocacure, Azulor, Illusiance, and there are some new fillers, new anti-wrinkle treatments that have also recently been launched. So I will talk about those probably on another webinar, because it's a whole topic in itself, the anti-wrinkle treatments. So I also do equal amount of dermal fillers, and dermal fillers come in various shapes and sizes. So when I first qualified, there was only 2 on the market. There was Restylane and Juvederm, and now they've evolved, and there are about 10 or 15 different products from each of those ranges now, and many more other brands have launched over the years. But I tend to stick to what I know best. I have tried other brands, I've tried other manufacturers, and I just don't find that anything lasts my clients as long as the Restylane range does. So I tend to stick with the Restylane portfolio. I do skin issue consultation. So this morning I've done a microneedling for treatment for someone who had pigmentation problems. So she's just on a 3rd treatment. So she had a few spots of skin damage, sun damage. So they're like the brown pigment patches that we get. So that they're starting to lighten. So she's about halfway through the course now. So it's not just pigmentation. I can consult on things like acne treatment, open pores, fine lines where people might not want to have injectable treatments. There are lots of other options to help out with the anti-aging. I did used to do PDO thread and body lifts, but I tend to find that fillers nowadays, there's so many different types of fillers that can lift just as well as them, so I tend not to do those so much at the moment. I do private health screening tests such as menopause bloods, diabetes checks and that sort of thing, and also I'm a prescriber, so I do private prescriptions as well. So I'm going to explain the basics of facial aging and the function of the skin, and what causes our facial folds and things like that, and how we can correct them. So aging skin, there's a lot of factors. So it can depend on genetics. So I'll just tell a little bit of a story. So we all can look in the mirror and find things that we are not 100% happy with. So the one that I focus on is my eyes. So I feel like I've got hoodie eyes, and that's genetic because I've got small eyes from my mum's side and heavy lids from my dad's side. So that's genetics for you. Biology, so it can be down to health conditions. There's people who don't produce as much as collagen and elastin as others. It can be to do with our diet, sun exposure, whether we're outside or indoors a lot, central heating, all that sort of things, and then mechanical, as in muscle strength and structure and that sort of thing. So these can all affect and speed up the aging process. So the skin has various layers, and it's the largest organ covering the whole of the external of our body, and it helps regulate our temperature. So knowing your skin can help you understand the aging issues and how to look after our skin at home with our skin care. So we have the hair on the surface of the skin. Obviously on the face it's much less noticeable unless you go through the menopause like me and you get the...
Yeah, I'm just busy at the moment.
So sometimes you can get the odd little hair when you're going through
1 minute, I can't hear you. 1 minute. 1 minute.
Sorry, I'm just going to ask someone to just move for a second.
And did you ask for something else? Right, okay.
Let's go back to it. So yeah, it's made up of all these different layers. So the most appropriate thing to do to prevent aging is to protect it. So I bang on to my clients. I used to do a minimum of SPF 30, but I actually now do an SPF 50, and how you apply it is really important. So we tend to squirt a little bit of cream on, rub it into our hands, and then rub it onto our face. That won't give you the full protection of the SPF 50. It has to be applied quite thickly and allowed to soak in to get the full benefits of it. And it also helps prevent pollution damage to our skin as well. So on the top layer of the skin, so this is our protective layer. So anything that sits on the outside of the skin is going to protect the barrier, but it's not actually going to penetrate the skin and treat it. The basal layer is like the factory of the skin. And this is where we need our skincare products to be able to reach. So like I say, it's like a little factory, and the more nutrients we can give to it, the better we will be able to protect it and take care of our skin. So in this little factory, we have all of these even smaller cells in there that are all communicating with each other and trying to protect and repair our skin. So you might have heard of collagen and elastin. These are extremely important, and this is what breaks down as we get older. And the only way that we can get collagen is from our diet, which I shall talk about later. So the skin cycle is between 4 to 6 weeks, and it slows down as we age. So the way that our skin exfoliates itself. So if we did nothing to our skin, it would look after itself, but it would be quite a slow process. And we can assist it with things like oil production, dryness, and that sort of thing. So the second layer, so let's have a look at the dermis. So this is underneath the skin. So this is where we start to notice the muscles are creating sagginess and fine lines and wrinkles in the skin. And this is where we need our products to penetrate. So cosmeceutical skincare actually penetrates, hydrates, and nourishes, whereas shop bought products sit on the surface of the skin, as we saw in the previous slide. Hair grows from the follicles in the dermis, and some people have asked me about a treatment called microblading, which takes the fine hairs off of our skin. I personally have researched it, and I don't recommend it as a treatment because those hairs are there for a purpose. They produce oil, and we need oil to prevent us aging, to keep the skin hydrated. So the sebaceous glands are at the base of the hair follicle, and the sweat glands are also at that layer in the deep skin. So if pores or hair follicles and glands get blocked, this can lead to inflammation and infection. So this is basically the cause of spots and or acne. And then we have our little veins and arteries that move everything around. And also, as we get older, if our skin gets thinner, we get visible veins and arteries around the mid-face. So the hypodermis is where the fat layer is. And when we age, we tend to lose fat, particularly in the mid and upper face. So the mid and upper face create what I call the aging triangle. So if you have volume in the mid and upper face, this is what creates a vector, a young, youthful looking profile. The collagen in our skin provides the strength, and the elastin allows it to be flexible and bounce back to its original shape. So as these decline with age, obviously our skin is going to take a lot more to recover. So they work in conjunction with each other. It's really important for the whole of our body. So not just for our skin and anti-aging, but for our bones, tendons, ligaments, everything. It protects everything, even the lining of the heart. So collagen works in conjunction with elastin, and you can't take elastin, or you can take collagen that then will help your body produce and maintain that elastin. So let's have a look at the difference between young skin and aging skin. So as you can see by this diagram, we've got lots of fat cells that are supporting the cheeks, helping the skin to sit where it does originally. And as we age, the skin is getting looser, the fat is deteriorating in the upper and mid face, and the supports are loosening, so the fat descends also and causes folds along the side of the face, between the nose, the mouth to the chin, and jowling. So as you can see here, and here's an example. So some people call it the aging triangle, some people call it the egg effect. So as you can see, young people, they have the top part of the face is fuller than the lower part, and as you get older, the lower part of the face starts to become fuller. So I call this the aging triangle. So as you can see, this is an exaggerated animation, I'm afraid. It's a poor lady. So I've put where we start to get folds, shadows, and things start to sink. So here's a photographic example of how this happens. And it's not just due to the skin and fat layer, it is also due to bone structure. So our bones actually start to recede in the jaw area, in the eye sockets start to widen, and bones start to shrink in the cheek area. So we've lost the foundation of what holds the face up as well. So if you imagine a pile of clothes on the floor, as opposed to being hung on a hanger. So we need this support in our upper face to hold everything up. So let's have a look at the natural way. So the way that you can look after your skin at home rather than having any in-clinic treatments. So it's relatively simple. So I've briefly mentioned the difference between cosmetic skincare and cosmeceuticals. Cosmetic skincare has to sit on shelves for numerous months. So it will have a long shelf life. That is because it's full of preservatives and filler ingredients that are needed for the product but not needed for your skin. So they don't treat the skin. So it's probably about 30% of products that your skin doesn't actually need. Whereas cosmeceuticals are full of active ingredients. I tend to do short orders because I have it made to order. So it only sits on my shelves for a maximum of 3 months because otherwise it goes off, because it's not full of preservatives. So it has special delivery systems to help it travel deep into your skin cells. And it's definitely worth investing in, because it will treat your skin at home without you having to have any injectables, and it will prevent the decline of the skin in aging. So shop purchase skincare sits on the top. Cosmeceutical delivers it to the skin factory that we spoke about, which is where you need it for the treatment. So collagen molecules are too large to penetrate the skin. So we can see these fancy creams in large department stores with fancy names, and they're very, very expensive, called collagen creams. They smell lovely, they feel lovely, but all that collagen molecule is going to do is sit on the top of your skin. It can't get in. These vitamins and minerals can get into the skin. Sorry, that's our weekly fire test at the clinic. But they won't penetrate the skin. So we need to have a look at other ways that we can get collagen molecule into our bodies. So cosmeceuticals can treat all of these and keep aging at bay at home. this is the where you can buy Flawlesseuticals from my brand, flawlesseuticals.com. I'm just going back to that collagen molecule picture because I'm going to talk now about how collagen can get into our system, which then kickstarts the elastin. So it can be absorbed through the digestive system, and the recommended daily amount is 2.5 to 10 grams daily. We can get collagen directly from our diet. So if you eat a healthy diet with lots of fish, protein, eggs, leafy green vegetables, nuts, pulses, fruits, we can get collagen from our diet. If we want to supplement our collagen, it's better to use a powder, a collagen powder. Now, I carefully researched this. I didn't like the taste of a lot of the collagen gels that were on the market. I researched collagen gummies and collagen capsules, which are harder to digest. So sometimes you could swallow it and you may not get any of the benefits of the collagen. So I decided to launch a powder and a non-flavored powder at that, because I've tried various different flavors, and all of them tended to leave an aftertaste. So I wanted a non-flavored powder that I could put in my own choice of drinks. So this can go in any drink. It not necessarily boiling hot drinks. So I tend to drink it in my room temperature coffee or tea, or have it with a shot of orange juice, or I have a green smoothie sometimes, and put it in with that, and you can't taste it at all. So it's very palatable and very easy to take. You can also put it in pancake topping, so mix it with a little bit of your honey or lemon juice or that sort of thing. So it's very, very easy to take. So as I've just said, capsules don't always break down, and you have to take quite a lot of the capsules to get the correct intake, which is that 2.5 to 10 grams a day. And flavoured gels, I actually went to a conference once and tried a sachet of a gel, and the taste was so awful, and I didn't have a drink on me. I literally had to find some, that had to rush to the toilet to spit it out. It was awful. So I am really fussy with my flavouring. So you can get bovine collagen and marine collagen. Marine collagen has superior bioavailability. So that means it makes it available and more easy to absorb in our own bodies. So there is also a vegan option, but main collagen supplements that are classed as vegan is vitamin C, basically, that is the main ingredient. So vitamin C will also help your body support collagen, but it's not necessarily a collagen supplement as such, whereas marine fish collagen is giving collagen to our body. So I'll now talk about non-surgical treatments, which, as I said at the beginning, is what I mainly do in my clinic on a day-to-day basis. So conditions that are treated non-surgically: acne, dark circles under the eye, facial folds, fine lines, pigmentation, scars, stretch marks, skin laxity, skin tags, stubborn fat, the thread veins that I was talking about when the skin thins, and also volume loss. So 1 in 4 women are considering Botox or dermal fillers, and 11% of men. It's extremely personal choice, and it's very private. So as a registered nurse, anything that happens in this clinic is completely confidential. And most of my clients do not like to allow me to use their before and after photos that I use for the medical records. I always ask people for consent, and most people want to keep it to themselves. It's a personal thing, and it's not something that you have to share. Some people say, oh yes, I've had my Botox and I want to share it with the world. Some people, it's very personal, so rest assured it's a very private thing when you come to this clinic. So when you're considering these treatments, you have to be very careful, because it needs to be safe, in a clean, ethical environment, confidential environment, ideally in a medical clinic like my own clinic here. So what to look out for: be careful making decisions based on cost. So this is the first thing. People will say to me, and I don't mind it at all, your prices are expensive. They are expensive. That's because the products that I use are the highest quality. They're expensive to me. I write a prescription for you personally. So it's a prescription only product in this country. So in the UK, any prescription products have to be safety tested by the MHRA, which is the governing body that tests that medicines are safe for use in the UK. So the products are expensive. So people might look for cheaper options, but it might not necessarily be that quality product. So that brings me on to poor quality products. You can buy dermal fillers and toxins from the internet. They're not guaranteed to be genuine. They're not guaranteed to be tested. Some of them are copies, and some of them sell to non-medically trained people. So it's not always the safest option. Rushing into treatments without really thinking about what it is you want to achieve, having a chat with the qualified practitioner to make sure it is that you both understand what the outcome is that you both want to achieve. And I'd say 90% of my clients want to still look natural. They don't want people to walk down the street or to see their friends and family and be asked, have you done something to your face? They want it to be natural, subtle, but to make them feel better. So it will be noticeable to us, but not generally looking like they've been in a wind tunnel to other people. So always think about visiting doing your research and going to a medical practitioner in a sterile medical environment. So skin can be stimulated and resurfaced without having injectables. There are lots of other options there. There's surgical treatment, non-surgical treatments for body areas. So like, as I was saying, I do remove some skin tags, moles, that sort of thing. And I also can do body lifts and fat dissolving in body areas. Things like peels, LED masks, medifacials, they're non-invasive, intradermal, so we're getting down to that deep skin layer, microneedling, PRP, mesotherapy, so they can all be done on the surface of the skin without actually literally injecting into the skin. And these all boost collagen. Going on to home care again, as I've mentioned before, cosmeceutical skincare used at home really looks after your skin without even walking into the clinic. And then we look at the further end of the scale, which is injectables. So we're looking at replacing lost volume in the upper 2/3 of the face, pulling back folds in the lower face. And before I see anybody, I talk through all of the options that stimulate collagen. We have a really in-depth, thorough consultation, facial assessment. You get a report of so you tell me what is bothering you in the mirror. I tell you all of the options that you can do about it. And then I give you the information to have a read of. I might send you some links so you can have a read and do further research on it for yourself, and also come in for a second or third consultation before having any treatment. There is no obligation. I pride myself on people being sure and confident in what they're having. So I recommend having that before considering any treatments. So we go through your expectations, a treatment plan, how much it will all cost, whether you need repeat treatments in the future, because dermal fillers last between 6 and 9 months, up to 2 years, some of them. Anti-wrinkle treatments tend to last 3 to 4 to 5 months. So there will be usually some repeat treatments. If you want to just try it and leave it, your skin won't be any worse for it. It just means that it will wear off eventually. And then I also offer everybody a follow-up and a check-up to see how they're doing, check that they're happy with the results, do any tweaks if we need to at that stage. So that is something over and above you may get from other clinics. Another question I get asked a lot is, do aesthetic treatments hurt? It depends how deep we're going and on what area. Lips, certainly, they're quite tender. I use a topical anesthetic cream to numb the skin, and also on areas I can put numbing cream on there. Also, if it means no pain at all, I can also offer local anesthetic injections to make it more comfortable. In a scale of hurt, everybody has different pain thresholds. Some people don't bat an eyelid, don't even feel it, and some people it might be a bit uncomfortable. So I do everything that I can to make it tolerable for you. So there is a difference between anti-wrinkle treatments and dermal fillers. Anti-wrinkle treatments are injected targeting the muscle. So we have muscles around our eyes, we have muscles that enable us to frown, we have muscles to enable us to lift our eyebrows. And so basically, toxin, it's a medicine that blocks the nerve system, and it does take a few days to take effect. So I tend to review people after a few days or a couple of weeks to see if they may need more treatment. Whereas dermal fillers are injected where they're needed, and they add volume, fullness, and literally fill where we need them to. So these fine lines here are caused by collagen breakdown and muscle overuse. Again, this is also a treatment that anti-wrinkle treatments would do. These are the three main areas. So forehead, frown line, around the eyes. And as I say, I only use reputable MHRA dermal fillers that are safe. And yes, they do cost, but it's really important to get quality products. So in a syringe, there's 1 ml of product. Some people might need 4 or 5 mils. Again, this is all discussed in consultation. So we can replace lost volume in all of these areas of the face. PDO thread lifts are something that also is like a non-surgical lift. And pre-assessment, I will mark up and guide you through exactly what I'm going to do. Here are some before and after pictures. So this is PDO threads and cheek filler. This is cheek filler and lips. Oh, sorry, I'll just go back to there. And then the specialist filler for under eye circles. Non-surgical nose treatments. So anti-wrinkle treatments last 3 to 4 months. Dermal filler treatments, depending on which product you use, can last 6 months to 2 years. And if there's any questions, please do email me or text me. This is where I'm located. Like I say, I cover all of these areas. I'm just easily accessible off the A1 on the Long Bennington Business Park. I'm on socials, LinkedIn, Instagram, Facebook at Flawless Aesthetic Clinic. Thank you very much for joining me. I also have a holistic website for mental health topics as well on nursesarahbarker.com. Thank you very much.